My name is Daniel W, and this is my GT project on career exploration, and it is on physical therapy. First, I want to consider on how do you become a physical therapist? And the first step is to complete your bachelor's degree. Although there isn't a specific major that is required for physical therapy, some of the things that are recommended are exercise science, kinesiology, biology, health sciences, and pre physical therapy. And before you need to apply to those physical therapy schools, you need to complete prerequisite courses. And this includes anatomy, physiology, biology, chemistry, physics, psychology, statistics, and exercise science. This may vary depending on where you live. Most physical therapy programs require you to have experience in working in physical therapy settings. And you can obtain this experience by volunteering or interning. And many physical therapists themselves recommend getting hands-on experiences in clinics, hospitals, or rehabilitation centers. You could also follow one around to understand what they do in their day-to-day life and work. You could also work as a physical therapy aide. This is an entry-level position into clinics and hospitals. Physical therapist aides help set up the equipment, allowing you to gain insight to the workplace. You can build relationships with physical therapists and other professionals in the field to get advice and possibly a mentorship, which could be very helpful when you apply to programs. Preparation. A physical therapist does more than assign an exercise to a patient. Their work is revolved around figuring out their patient's pain and doing their hardest to relieve it, in turn, improving the quality of their life. Each person is unique, so the treatment can be different. For example, a person who suffered a gunshot and can't walk, or maybe a person that has something as simple as it just hurts when they move their arm. A physical therapist strives to understand their patient's conditions and feel a kind of empathy for them on a personal bond. With each patient, a personalized test is required. They do movement screenings, which is essentially them checking up on how much progress you have made. Another thing is they don't take their patient's pain or suffering at face value. Instead, they check medical history, family history, occupation, level of fitness. All that comes into play for what a physical therapist must consider to decide what further action they will take. Hands on. One part of the work includes hands on techniques to gain a feel of the soft tissues and joints to relieve the pain, increase flexibility, and reduce muscle tensions. These techniques may include straightforward things like massages and stretching. Not only do physical therapists have to do their work, but their clients must work too. But first, the physical therapist needs to teach their patient. Teaching patients about their injury or condition is an important part of physical therapy. They may need to explain anatomy, movement patterns, and telling their patients how to change their lifestyles. In addition, telling their patients education on posture and body mechanics, how to move safely, is needed to prevent re injuring. For patients with nerve damage or muscle weakness, they will need to retrain their patient's body to perform specific movements better, such as opening a soda can or running. This may involve balance exercises or motor controls activities. Why become one? In the United States, the average salary for physical therapists is around 90,000 to 100,000 per year. However, this can vary on things like experience. Newer physical therapists tend to start at a lower salary, while those with 5 to 10 years of experience can see a significant pay increase. Experienced physical therapists can earn upwards to 100,000, especially if they specialize or work in high demand areas. Another thing that fluctuates pay is the location. Salaries can differ by state and even by city. For example, physical therapists in places with a higher cost of living, like California or New York, tend to earn more. However, salaries may be lower in rural areas compared to urban. All that money looks nice, however, that's not the only reason why people become physical therapists. Despite the challenges, there are many rewarding aspects of becoming a physical therapist, one of which is patient progress. Seeing your patients improve, whether it's a patient regaining the ability to walk, a senior citizen reducing their fall risk, or an athlete returning to their sport, these moments of progress make all the hard work worth it. Another thing is building strong bonds. Many physical therapists form deep, lasting relationships with their patients, watching them grow from injury to full recovery. Some of them develop long-term patient relationships that last years. In conclusion, being a physical therapist is a challenging job that's much more than just helping people with their injuries. It takes a bit of medical knowledge, kindness, patience, and great communication skills. You're not just fixing people, you're teaching them, encouraging them, and helping them to stay healthy for the long run. Whether you're helping someone walk again after a stroke, recover from surgery, or deal with long term pain, the difference you make in their life is huge. Being a physical therapist means using both your skills and your heart to help people. While it can be tough, the rewards like seeing someone walk again or live without pain make it all worth it. This is the works cited.